Hi, everybody. Cynthia Gomez. I am Professor Emeritus from both UCSF, where I was the co-director of the Center for Studies, and at San Francisco State, where I was the founding director of the Health Equity Institute. And I'll say more about the health equity side on Friday at a different session. But today I wanted to really focus on community engaged research and really just talk about the history of it, because today we kind of talk about it as if it's always existed or that somehow it's the standard. And well, first of all, we're not even close to really, I think, doing it in a way that is most effective. But it's also a fairly recent phenomenon. And so I just wanted to take us through about how that has happened over time, kind of where we're at today, and to think about your projects, not only in terms of the CABs that you've been asked to do, but more broadly about community engagement and what does that mean for your projects? What does that look like? Um, and so why is there an interest in community engaged research? Why did that emerge? And I think it keeps coming up in different ways as to why it has emerged and why it's used. But I also get concerned in that people call their work community engaged when it isn't. So of course the interest came in when we started to recognize social determinants of health as important. There was a lot of complaint about this gap between science and practice. Like, why is our science not being relevant to our practice? People who wanted community relevant science, like if the community really knows what their local problems are, why aren't scientists actually studying those problems? The need to, address the health inequities that we were being made aware of, because I feel they've always been there, but we were finally getting the evidence. Of course, the continued underrepresentation of BIPOC in research in general, both as participants and as scientists. The sustained mistrust, distrust, um, of research by communities that most need really good science. And again, the potential for greater impact of science, both with increased science literacy for the community. I think, we keep not educating our communities in a way that helps them really benefit in get the literacy of science enough to be able to ask um, what is needed and wanted. And I think that lies in part on current researchers on how to do that, in the same way that the community really tries to help researchers with our literacy. But I don't think that it's always reciprocal, and would really, really, from the community perspective, and I will say, just in my own professional path, so I'm a child clinical psychologist by training. I ran a mental health center in Boston before the HIV pandemic emerged, and I was there as it emerged. And a lot of my work was really close with community as a provider. And so when I moved to UCSF, it was a huge shock because everyone there was doing research with populations that most of them had never walked into those communities. And I didn't understand that as somebody coming from working in the community. I just didn't understand how the science worked if you had never either spoken to or even been in neighborhoods that you were studying. So in really trying to understand from the community what the barriers were, from their perspective, it was barriers to gaining access to the scientific information. I came to a meeting here in New York early on, hosted by a private foundation of community-based organizations working in HIV. And their huge complaint during that meeting was their lack of access to all of the data that the center here was getting about HIV in New York, and how they couldn't do anything programmatically that was science-based because they weren't being given access to that information. So even the organizations, let alone the community at large. So that was viewed as a huge barrier. Again, limited understanding of what it meant for their work and the health of their community, speaking about organizations. So, it kind of ended, a lot of our science was ending in the journals and not in the hands of people who really needed to understand how it would impact their programs. again, in the experience with researchers, poor relations. I mean, when I first was doing an drug user study in East Palo Alto, community very overstudied by Stanford. It was really tough because they were like, who are you? You're coming into our community. And I was like, absolutely, you don't know who I am. What can I do to get your trust? And, this is what I'm requesting of those of you who are here serving your community. We wanted a safe space to be able to recruit, interview, and test HIV positive injection drug users. And so, I wanted to get a sense of where we could do this, that they felt the community would feel safe about it. So we rented a trailer from a local community member who said, well, you can rent my trailer that's behind the taxi parking lot. And, like, okay. And, we kind of kept investigating other ways that would be helpful. And he says, well, you have to help, Mrs. Smith, who does this homeless meal every day. So I would hope your team would help her peel potatoes in the morning. So I said, okay. I told my team we're peeling potatoes in the morning before we see our participants. So some of it is trying to develop those relationships, right? And that meant so much to them.
Yeah.
The fact that I would say yes, and I, the PI, was right there with them peeling potatoes, was just an investment, right, on my part as an investigator, to show the intention is really that we want to do good. And so again, trying to make that clear, as opposed to the sense that researchers are more interested in their own advancement, and that this is just one of many projects. That we're just using and not bringing information back. And so that was another key thing, was how we were going to bring that information back. And so making, again, a lot of discussion with our community partners about how best to do that, what would be helpful, et cetera, in doing that.
Cynthia, I do have a question. So
yeah.
But if they had the pillar thing. So I think I've heard people talk about this a bit in terms of like what are our limitations as researchers when we're engaging populations. So a lot of times people will ask you for rides, and I've done it. I mean, is that okay? But they're like, what's the guidance around that?
So,
it's close. Can you?
Yeah. Well, I can tell you, in our studies, we had strict boundaries with our staff, with our team, about what they could do with participants. With research participants.
But you created,
which is a little different than what you're doing in the community that you're trying to build a relationship with.
Got it.
So that's why I want to expand this notion of what it means to be community engaged. It's not just what you're doing with your participants, but what are you doing in the community from which you're going to recruit your participants, right? So almost that preparedness, community preparedness, so that people know who you are. You're not just coming in and out, and they don't know, like, what did you do and what did you take and what did you give, right? But with our team, we did have very strict protocols around that. And it was really hard for some of our team members who had been users in the past, and they're trying to be helpful, right? So somebody said, can I use your phone? I just need to make a call. And we debriefed this as a team over and over again about what people might ask of them and how they would respond. And at first, a couple of team members thought I was being too rigid. And until one of the users, and these are all active users, one of our participants gave us feedback about what they liked about being in the project. And what they said is, I can't con anybody. That was the response. Like, nobody, and that feels respectful to me. It means you know what you're doing. And it was a very interesting exchange with that participant. Now, other participants may not feel the same way, but in some ways it reinforced this notion that we're really here with a role. And as much as we'd want to help you in other ways personally, in our current role, this is not how we're able to. And I think people,
like that.
again, respected that.
Like boundaries is like a, like love.
Yeah,
almost.
yeah,
Yeah.
yeah. And ultimately the team was like, oh, wow, okay, now I understand why we're
Got it.
doing it this way. But you know, it was a hard one.
It's hard, especially when your staff, like if they're young or they have a background in service, direct client service. So these are people who are drawn to this probably poorly paid work for good reasons. But it's also, you know, there's those boundaries. And I just remember my project coordinator being on a recent call, like, so how many snacks should we be giving each participant? Because we have these people who are coming in like once and twice a day for a bag of chips. And I have one research assistant in particular who like gives out cigarettes despite the fact that they don't smoke. So she's like beloved. And I was like, listen, you can't be the intervention. Like we need to dial this back just a little bit. But it's true. You have to, those are things like I wouldn't even necessarily have thought about because I don't write the checks for the snacks. I just get the money that writes the checks for the snacks. So like it's important.
Yeah, and again, I think it's not that you want to be, you know, that you don't want to reemphasize this power differential as much as you want to what your role is at that moment with that person, and for it not to get confusing for, oh, maybe they would be my friend, right? When in fact that's probably not likely to happen, right? And so in some ways it's really, again, being respectful of the role, and we appreciated the feedback that was actually helpful. So again, you know, how do we define community engaged research? Well, you know, this, again, talking about organizationally, you know, it really should be a meaningful collaboration when you're thinking about this. Is it really something that you're doing just because you need to, or is it really something that you find meaning in as a researcher in doing this? And ideally, it's interdependent and mutually beneficial. That does, like any relationship, require really good communication and negotiation to reach those common goals. Now, I gave you a couple of quite old articles for this that had to do with a program evaluation, but it was designed by Northern California grant makers in an attempt to see if researchers and community organizations could in fact work together to help the community organization with the original thing write competitive proposals to the foundation, and that the foundation would feel secure enough, if you will, that the organization had the capacity to do what we were going to do. But we really, I mean, of course, you know, for my particular, the article that you read of mine was really about that process that I went through with my equivalent in the community organization, and how we negotiated and how basically I did back translation of the terminology, because terms that I used were different than terms that Monica used, and yet we were talking about the same thing, but I was doing it in science speak. And so we were helping each other, like, wait, we're talking about the same thing. It's just that it's labeled. So, you know, some of that is just to give you that sense of the negotiations and the goals. I always love to do this, which is what is the definition of collaboration? And there are two different ways to think about it. You know, and so, you know, number two is often how our community partners feel. That's actually a definition of collaboration. So, you know, just recognize that that in some ways, for a lot of communities, we are the enemy that is invaded. Now, one of the things that I came up with many years ago, and again, this is way before we were talking about community engaged research, but I encountered this really early on, and I think I told the story last year that my first day as a researcher, not my first day, but my first month, when I had shifted from being a clinician to being a researcher, I went to the substance abuse conference in LA, and I was listening to a great session, and it was this panel of community organizations talking about, you know, the work and I raised my hand, and you had to identify yourself and your affiliation. And so I identified myself as a researcher at UCSF. And before I could say anything practically, I was bombarded with, you people don't know what you're talking about. You're entitled. I mean, I just, like, it all came right at me. And I kind of appreciate that because it made me aware right away of a dynamic that was existing very early in the HIV world as we were trying to save the world from our perspective, but from our different lenses. And I had just moved lenses a little ambivalently. And suddenly I was the enemy invading somebody else's country. And I thought, oh, but I was originally from your country, like, a real adjustment. Yeah. But what I then started to identify is why is there this tension in practical terms? What's going on? And so I came up with this name that reflected in my mind sort of the Mort syndrome, the thing that was killing the ability to have these positive relationships between my community partners and, well, researchers and community partners in general. The big one being money, right? So we get these multi-million-dollar research grants, and then we ask a CBO, community-based organization, if we can pay them $200 to use their site to do an interview. And really different, and even though the $200 for them is a lot of money, but it's sort of like thinking through, how can we share resources in a way that's a bit more equitable? And structurally, of course, it's not possible in the sense that the salaries are extremely different, but are there ways? And this is something I'd encourage you, if you're doing this kind of collaboration, can you hire one of their staff people that they already have on their books and use that to be one of your staff on your grant? So different ways of thinking about how to share resources that the system and the structure may not let you do easily. But if you're creative, you can both do that and also demonstrate that, you're trying to make this in some way more resource fair. We
Can I
also
say something
yeah.
about this?
Yeah.
You can say, for example, that you can use this community-based organization for recruitment, that they would your initial seeds, if you're doing social network and study, or that they would do the recruitment for you, and then you might help with that. Even if they don't recruit the full sample that you need, nobody needs to know that, right? So that's a way in which I provide funding for a community-based organization as a citizenship exchange provider in rural Puerto Rico in the mountains. So if there's a will, there's a way.
Yeah.
But you have to be mindful.
No, absolutely. No, and that's the thing, is getting creative about ways to do this. And people will really appreciate your effort, right? Whether you can do it in a way that, the other way we try to do is through policy change, which is to ask NIH to actually directly allow you to fund your community partners, or so they get their own budget, not that it's being filtered through a university with their own indirect costs, so that they could have it more.
They ever allow that?
There've been certain private calls that have been to CDC more than NIH. But there have been targeted calls for that. We're still working.
I was just wondering if you can build that into a non-targeted grant.
I don't think so.
Yeah, probably not. Yeah.
No, not as
Can be
it's a subcontract.
too administrative in the weeds, but it can be better to give fee for service deliverable contracts than subawards, because oftentimes they don't have an indirect rate that is actually going to reimburse them for the full amount of their indirect costs, because the CBOs are getting most of their money from HRSA and CDC and other sources that don't reimburse a full indirect rate. They reimburse normally a cap of 10%. So all the CBOs try to keep their indirect rates as low as possible and then put most of their indirect costs as direct costs. So like facilities, occupancy, copiers, IT are all direct costs when you work with a CBO, because they won't get reimbursed for them otherwise.
That's right.
And the subawards are harder to manage. The federal regulations get flowed down to any subaward recipient. And a lot of CBOs just don't have the administrative infrastructure to actually comply with those regulations. And so a fee for service or deliverable contract, like sort of what Roberto said, if you can give them a contract where they're paid a flat $10,000 to recruit 50 people, that's easier for them oftentimes, as long as $10,000 actually is enough to pay for the time it's gonna take them to recruit those people.
And that's
Yeah,
what
a
we
lot of
found,
CBOs,
especially
it's a
with-
lot easier that way.
Especially with renting space because university didn't want to hold on to space for interviews. So we're like, well, then we need to rent the space. And so it was a direct cost. But I will say that I would prefer that the organization make that decision.
Oh, yeah.
Preference would be, because they also want the prestige of being a sub awardee possibly. So, you know, you just never know, sort of trying to think about it. But I think in both instances, the point here is to create sort of that transparency about what can we do to make this as fair as possible. The other thing is ownership. Who owns and makes decisions before, during, and after the work is completed, and the dissemination needs. So who owns the data? So a lot early on in community engaged research, all the researchers was like, well, I can't share my data with my partner because they can't, they're going to say what the outcome was and then I can't publish, you know, because it's going to be out there. And so a lot of things had to be sort of thought through together about this in terms of shared ownership of the data, but then a real deep discussion about how it's going to be shared, what venues is going to be shared. So these were just issues that came up again in general. The rigor, you know, the scientific protocols, we've been talking a lot about protocols. If you're implementing this in real world settings, you have to make sure that it's actually feasible. Because often we'll make these protocols and then you go out to the real world to do this data collection and like the nurse is like, we can't do that here. Like who said we could do that? We're not going to be able to follow that protocol, or, you know, at a community clinic. But we need things to be a certain way. And so making sure that that discussion has happened and that you can verify that the people that are going to be implementing that protocol really can implement the protocol, etc. Just making sure that people understand on both sides, right? People understanding why we need that rigor in science, and scientists understanding why we need to figure out whether it's feasible in the real world, because we might be creating expectations that just aren't based on reality. And then, you know, the timeframes, right? For us, it's 5 years minimally to get those outcomes out. The agency's like, we don't know if we'll exist in 5 years. I need to know now what my patients need or what my, you know, folks need here. So anyway, this was what we then called the Mort syndrome, which is just to try to get people to focus in on these 4 categories as at least what was coming up at the time as the biggest sort of concerns. I'm gonna just so in thinking about this spectrum of engagement, because you're all sort of thinking about different things, I just wanted to talk about there's, you know, a lot of different things that you could engage in all the way through. And for some, that's your more traditional community-based participatory research. Very few people actually engage in that, because that it really is a whole different way of doing science. And but there's so many other places where collaborative activities really could help in terms of, you know, bringing people in at these different phases, you know, from the initially, you know, formulating it to, you know, dissemination and everything in between. And then what are the roles, right? And so, you know, in our communities, we typically had only thought of them as research participants. And then we got a little better when community advisory boards came in, like, oh, maybe we should talk to somebody that's in that community before we do research on them. And so, but then, you know, you can have them as consultants, right, as well. Doesn't have to always be a group situation. How else are you bringing them in? They can be true collaborators with you. What does that look like? They can be co-researchers with you. Again, we're finally getting there. I mean, this is one that I'm just starting to see sort of a real acceptance of some of that. And of course, co-authorship. I mean, really, you know, we are in professional roles that require publications for our promotions. Our community partners are not typically in that situation, but it is so meaningful for them to be able to engage with you at this level and their perspective in that authorship in terms of how you're conveying some of that information. So again, that article that I gave you was co-authored with my partner, and she really, you know, helped me get out of my science speaks so much, and so much so is that that article was selected by the Nursing Association, National Nursing Association, as an assigned article because they felt that it was more um, accessible to a broader community in terms of how it was written. So it's very sort of in plain language, if you will. So again, think about all these different types of engagement that you can have. And, you know, where is it going to be most impactful both for you and the communities that you're engaging with? And, you know, these are things we've talked about. So, it brings together things that so that we can better impact social and environmental injustice and differences. If we are doing this with our community partners, it increases the likelihood that this knowledge and these interventions are going to be appropriate to the communities that we're studying and trying to do and transform this relationship between community and science. I mean, I kind of feel like for a while we were working in the right direction, and I feel like we've slid again, And COVID really kind of took us back to the, are you guys crazy? You tell us to do this and then you tell us to do that. I was asked to do a panel on medical mistrust. And we talked a lot about the fact that we don't acknowledge that medicine is a trial and error at all times. It's trial and error. And we have deceived the public to think that we know the answers. And so when we change from, oh no, you don't need a mask to, oh, you do need a mask, it's not because we're just being weird, because new data came that made us recognize that we were wrong. But we don't say that. We don't say we were wrong. Now we know this, and that's why we're asking you. So our public health messaging doesn't really convey the trial and error nature of science. And I think we need to do with that. So I'm going to just, not go through all this because I know that we're going to hear more about specific studies as well, but just, the best practices, make the commitment to building and maintaining trust with your community partners, consider doing networks in your communities that you would maintain over time. Some places have done this to share interests so that you can come up with ideas together. Think about what the evolving research needs are in the community through going to community meetings of different kinds. And get to know your community partners. And again, I'm talking organizational partners right now outside of these meetings, so that you develop a true collaborative relationship. And again, this frank communication and all the barriers that come with a community academic collaboration. And, making sure that you take the time, like I said, to build the institutional relationships, defining the decision-making power, like be honest about it. Like, yeah, we're doing this, but you know what? I have to, with your input, but I have to take responsibility for that final decision. And making that clear and making sure that it's not something like, oh, I didn't know that. And that's why we really encourage memorandum of understanding that really, really details the roles and responsibilities of each. And, mention humility again. I think there's not enough of that amongst us, and we really need to work on it. I think it's hard. And, really recognizing that there's so much we can learn from our communities that makes us better researchers. Please.
I just think when it comes to MOUs, right, like it's very important to like outline what we intend to give back from the beginning and to do so in a way that obligates us to do that. So things like, I'm going to create a report that will be useful for you in your future fundraising. I'm going to create a report that's accessible to your participants. I'm going to show up. I'm going to pay for lunch and give a talk to your staff and anybody else who'd like to join, like whatever you think is appropriate for your study, but like getting that in writing and make sure that they know that you did that intentionally and that you expect them to hold you accountable to that.
Absolutely. And again, just different things to pay attention to, these social identities and differences that might, we talked a little bit that earlier, like make sure you're conscious of this dynamic. Are you coming from different cultural backgrounds? Keep that historical reputation front and center. That's what a lot of people still are holding on to. And, you know, again, I worry when I see researchers approaching organizations that are barely surviving and then asking them to do stuff that's going to take them away from their primary function for my purposes. And even though it might seem like we're being helpful, like I said earlier, if I pay for one of their staff, it's not going to be helpful if I'm only doing that for 6 months and then I'm pulling out. So just be, you know, mindful of that and have, again, a frank conversation. If it's somebody that feels you should be collaborating with them, just to be able to say, look, this is going to take away from what you need to be doing. And as we said, share resources as possible. And, you know, try to accommodate. We often make people come to us. I really encourage people to go to your communities directly. This is probably more detailed than we need, but just ensuring, again, the access to the data and dissemination. We did what we called community meetings of our findings. And so what we did is we you know, let everybody know we were going to do that in advance. We picked a location that was accessible, public transportation. It was both for participants and organizations, although that role wasn't defined in any way. It's just that everyone was invited to hear about this. We served food. The team spent a day like planning the food, and we went to the location. 2 people came, but it didn't matter. We kept our promise about what we were going to do and what people wanted. And it wasn't, you know, like, you know, somebody said, well, weren't you pissed off that you went through all of that and then nobody shows? I said, no, not at all. You know, you just know that people knew they had the opportunity if they wanted to. And that's what mattered. Not so much whether they showed up or not, but that you had actually made the effort. So anyway, these are questions that we can talk about later, but I just want you to think about in your heads as you're thinking about community engaged research.
I'm going to jump in a minute, just so that we have enough time for discussion. I'm sure folks are getting tired closer to the end of the day. Thanks so much, Cynthia, for that wonderful overview. So I'm going to talk about community advisory boards, and there are a few examples of community engagement in some of my HIV and sexual health research, and then we can circle back to the question that was shared at the beginning. I'm just introducing, sorry.
Oh, okay. Everybody quiet. I knew that. Okay, I'm here.
Yeah.
Quiet too. All right. Okay.
Do you want to say anything before I jump in?
No, I wanted to hear you. I was talking, so I could.
I didn't say anything of substance yet.
Okay.
Goldenberg, I'm faculty at San Diego State University and an alum of this program. So I'm going to talk a little bit about my MRP very briefly, because this was quite a long time ago. Gosh, I look really young here. And then also some of my more recent research that's been ongoing in Canada, and some new community engagement that I've been doing sort of at I would say the beginning of the life cycle of community engagement with new partners. So I can share things at a few different stages. So my MRP was my first experience with a CAB. At that time with this institute, it was sort of a minimum requirement that we have a CAB, and we receive training and, you know, what that looks like for the first time. And I found that to be a really formative and helpful experience. So my MRP project was focused on barriers and facilitators to the ethical engagement of migrant women who do sex work at the Mexico-Guatemala border. I had done work in this field already elsewhere, and I had other academic collaborators who had like an ongoing R01 that was at its sort of early stages at the same time as this. And so I was able to piggyback with their infrastructure, but all those relationships were new as well. So the community really appreciated this opportunity to be engaged at the beginning of the development of this program of research. So the community advisory board for this project was comprised of women, sex worker, and public health organizations and institutions. And I asked for feedback on our research approaches, data collection instruments, the use of language, and those sorts of things. And it was helpful in terms of building community connections that continued through subsequent stages of the parent R01 grant. After my own research was done, I also received other funding after this. or maybe in tandem with this, I can't remember the exact timing for, just HIV and substance use related research with this population. And so all of the strategies that we were developing through the MRP were being implemented in my ongoing research at the time, which was helpful. Some of the challenges that I experienced and some of the insights I just wanted to share related to this process at the time had to do, and I think this continues through all of the community advisory boards and community engagement strategies that I've worked through over the years, has been also related to the sort of politics and the differences in perspective that can sometimes arise when you bring different community organizations together that might not be regularly collaborating. And so for me in this area of research, I'm sure you can imagine that there are many political and social tensions. And so, for example, like one of the women's organizations that was present had a real difference in opinion with the sex worker rights organization about like the status of women and trafficking and defining sex work. And these conversations that had the potential to be quite explosive, like sort of emerged as sort of this naive postdoc, like in front of my eyes. And I'm like, how would this happen? And so just then it was a real learning opportunity for us to just practice those skills of diplomacy and consensus building and sort of just listening, and then not necessarily validating one perspective over the other, but like just sort of managing that conversation and then having individual interactions with those organizations from that point forward to make sure that like, okay, in our use of language, we're open to the fact that, we're going to let community members self-identify. But, based on the scientific literature and our work with sex workers elsewhere, like this is the kind of international consensus on the respectful language we should start with. But of course, folks might identify this way or that way, and that's fine. As the outsiders, we're not going to say which is right and which is wrong. So, we had to figure out some pieces like that were interesting, but the CAB had really helpful feedback. They decimated our instruments. And so we arrived in Guatemala and I only had funding for 2 visits. And, we had to change all of our instruments on the spot. Like we had gotten feedback from we were partnering with an HIV prevention organization that routinely works with this population. We've been doing these CDC surveillance studies with them for years. Like I thought we had it all dialed in. They gave us lots of feedback on the instruments. And then when we got there, everyone was like, this doesn't make sense. Like people are not going to understand this. And the participants as well had different feedback for us. So we had to do a lot of thinking on our feet. But I'm really, really, really glad that we were receptive and able to, and we had this feedback early, because if we hadn't, I think we would have had really flawed data. So the feedback was really helpful. The language, as we've discussed in terms of like community identification, was really important. We got really helpful feedback on how we should be approaching people, where we should be approaching people, where we should not be approaching people, how to deal with the police, how to deal with immigration. So a lot of things that helped me build like a safer, more inclusive, and I think like more rigorous research infrastructure from this point forward. So I was really happy I did it and had sort of felt like, oh gosh, I wish I had done this, with all my research prior to this. And so it was a great learning experience. And of course, when I was a doctoral student, the studies that I worked on, had their own CAPs, but I wasn't involved in that process. I was often just using the data sort of later stages as a student. So this was a really important process and built just some really wonderful connections. Another study I wanted to share that has had sort of a more sort of beginning to end life cycle of community engagement is a longitudinal cohort study that I've been involved with for the last 10 years now. I came on the scene, this study started in 2010 as a NIDA funded study. In 2013, I joined this research center as a postdoc and then moved into a co-PI role and then led the last renewal for this cohort in 2020. So we've got about another 1.5 years left on the study, and then it'll be wrapping up as a 15-year cohort. So this is a community-based prospective cohort of, we have almost 900 women sex workers now enrolled across Metro Vancouver. We have used this study as a platform for the evaluation of structural factors and social inequities on HIV, STI, overdose, and related health outcomes. And all of our data collection is by staff with either like lived experience as in sex work, or related aspects like substance use. And if not that, then at minimum, like deep community experience, like having worked at community partner agencies, drop-in centers, outreach programs with the population. So this data collection is not led by university-based RAs, and that's really important. And I'll talk a little bit about that lived experience and why it's important as I move forward. And, I think those other aspects here are not really needed to cover so much at this time, but just to say that we see folks semi-annually. And so our community advisory board for Aisha is comprised of over 15 local organizations. In the last few years, we've definitely prioritized scheduling around the sex work community partners and like other agencies that can come. It's great, but those are the minimum voices we need to feel good about this work. So the sort of number of those organizations has fluctuated as some have been on like shoestring budgets and have disappeared over the years, and others have had like a more permanent sort of fixture in the local advocacy and support landscape. But we've had really, I think, respectful relationships with those organizations over time, and that is honestly what's allowed this work to happen. We've also had, public health and other relevant agencies at the table with us, and there are different consortia as well of these groups that have come together over the years to address different initiatives, whether related to like over policing of sex work or the overdose crisis and different things that have happened where we've invited those folks as well. And then individuals with lived experience of sex work are also on the CAB. Sometimes we've convened that group separately, and other times they have felt comfortable joining the larger session. And so we've taken a pretty flexible approach there, but it's sort of over the last 5 years, we've had ongoing discussions where we've tried to get these participant working groups together, and they've sort of worked and sort of not. And so we always engage people somehow in sharing the findings, at least every year and asking for feedback. But the way that we do that is dependent on a lot of things, including folks' availability and comfort, and then the bandwidth and comfort of our own staff as well to convene these processes. We have a multilingual and a multicultural team. And so sex workers in Vancouver are very diverse. We have an overrepresentation of Indigenous women within the study. So we've prioritized that within our hiring. And then we also have about a third of the cohort are migrant sex workers from Asian countries. And so our outreach team that goes out weekly, once or twice a week, is Mandarin speaking to the massage parlors and places where those folks work, which requires a very different approach than more of the like Indigenous and other Canadian born women who use drugs, who are more involved in street-based scenes. So we need a diversity of approaches to engage. And then we do a lot of distribution of supplies. We have a mobile nursing team. We distribute over 100,000 condoms every year. Safer crack smoking kits, safe injection equipment, different things that folks need. In the winter, we're distributing warm gloves and socks and hand warmers. And in the summer, it's stuff to help people keep cool and going around with a cooler with popsicles. And so, we're really trying to be flexible towards community needs. And something that our team initiated over the last year that I'm really proud of as well is we started to do drop-in nights. So we have a really beautiful research space that opened just before the pandemic. So as you can imagine, it was underutilized for some time. But over the past year, we started getting a lot of donations of like clothing and makeup and things like that. And so we started doing these monthly drop-in nights where the participants or non-participants can come in, and there's food, and people have had a lot of fun. And we've been building knowledge translation into that as well. So at the last event, we put up like a timeline of different legislative changes that occurred over the life of the study. There have been several changes to the status of sex work in Canada, and we've used a lot of our research evidence to try to inform that policy change. And so our coordinators made this beautiful timeline of like some of those changes and where our research fed into different processes, different Supreme Court cases where the evidence was used, and how we tried to argue for the rights of the communities that we serve. And so I think we're still working on getting participants more engaged and interested in all of that, but it was we tried different efforts over time, basically, of how to share the information at the grassroots level. I think at the CAB, we've figured that out pretty well, but at the participant level, we're always trying different things. We do a lot of knowledge translation. Yeah.
And Chair, can I ask you real quickly a question about the separation in the CAB?
Yes.
Can you say more about whether you felt like folks who really represented your sample were how their input differed when they joined the larger group versus when you had the smaller group?
Yeah. That's a good question. I don't know that it differed. I think people have more time and space in the separate group. And so that's really the reason why we prefer to do that if possible. We also didn't want people to feel siloed. So there are some sex workers that feel very comfortable and are real advocates in their community. They don't mind speaking in front of the CDC or whoever's there. And others, like are more of our migrant sex work cohort, where there's huge cultural stigma around sex work. A lot of women are, they're afraid they're going to be in the news, or their children are going to find out or whatever, and they will not speak publicly. And so that needs to be basically like a one-on-one session or a small session, like with us going with printed materials to the massage parlors in their language and having a sort of informal focus group of what we found and what you think. And we're doing that now, actually. And for the first time, we're using QR codes on the posters where they can scan it with their phones because they don't want to have the printed materials on them either. And they can look at it sort of at their convenience. So I feel like with time and technology, we've had to always be doing different things. So there's not been any one size fits all that's worked out, and it has had to be a bit flexible.
Great, thank you.
So I remember when you presented that text before, like, how did that come about?
Which text? This?
Mhm.
Oh, the textbook.
Mhm, mhm.
Yes, yeah. So that's, we put it on the recommended readings as well for this year. If anybody is working with sex workers, this text is something that I'm really proud of. So our sort of second, editor, Ruth Morgan Thomas, was the executive director of the Global Network of Sex Work Projects for a really long time and has been a huge advocate in the field of sex work. And so we were approached, myself and another academic, by Springer, for this textbook, and we reached out to NSWP, who really represent like people with lived experience across the globe and the grassroots organizations that support them in most countries. And they were really excited about this as a community academic partnership. And so this book is edited by both sex work, academic, community organizers, and sex workers. And each chapter we sort of matched up an academic and a community co-author to lead each chapter. And so the community co-authors were identified by NSWP, and we applied for a grant through the Open Society Foundations to be able to provide a stipend to the community co-authors who contributed to the chapters, and also $8,000 to publish this open access to make sure that community around the globe could have, free access to the text. So that was really great. And that was a huge priority for OSF. Actually, they were the ones that flagged the opportunity for them to increase the budget to cover the open access. So my institution split that with them, and that was hugely helpful. So yeah, that's a book I'm really proud of. And I think the findings are different because of that collaboration. Each chapter has, community case studies that are written just less formally, easier to understand, more direct, current conditions on the ground that the community organizations were facing that either triangulated or added a slightly different perspective or more complexity to what the academic literature review would have been telling you otherwise. So it was a really nice collaboration. It was a lot of work, and for me, for very little academic credit, so I think academic institutions need to change also how we value these kinds of projects, but I have no second thoughts about having done this, but
That's awesome.
yeah.
I just want to say I love your work, just in case I don't have an opportunity. It's very you just have such command over it, and you're actually the first RETI person that I saw present at APHA. Celia doesn't remember, but y'all have a panel. Does anyone remember that?
No,
It was amazing. Yeah, American.
San Diego?
No, it wasn't San Diego. You guys presented the
I
RETI
think
at an
Brandon
APHA.
went to-
Was it Primer or was it AP?
Disneyland, I think it was Prima.
Oh, maybe Primer.
Or was it ASBH?
In
Anaheim.
No,
Yeah.
it was
Anaheim, the one.
Anaheim. Brenda and I went to Disneyland.
It's Primer.
Oh, God, yeah.
to Disney. I don't remember, but no, you totally were. It was APHA. Celia, it was APHA.
She thinks you're amazing.
That was bottom line.
Saying what?
Yeah.
She's your
I'm
fan.
remembering Disney.
Wasn't it Disneyland?
That was fun.
What I wanted to talk about was knowledge translation, and that's been brought up by Cynthia, is that I think when we think about community engagement, there's no one size fits all, and there's this whole spectrum of activities you can do, right? And right at the end of that spectrum is not just the dissemination, but also the feedback loop of how does our research inform action? How does it inform change? Whether that's at the policy level with advocating for legislative changes when we're dealing with populations that face extreme human rights violations, or whether it's at the programmatic level with public health, advocating for funding for our community partners. They're typically filling in gaps that the government is not supporting in programming that should exist, right? And so I think we need to really fight for them. And so I totally agree with Alexis's comment earlier and the guidance around MOUs. I actually, I need to do more of that. For me, it's been other formats of negotiating those things, but I think that it is sort of a best practice, and definitely at the beginning of really laying out these plans, what will we bring back? And because community partners don't care about research most of the time. In and of itself, they have totally different priorities than us. And so we really need to find that common ground if we're going to work together, for it to be ethical and for it to work with them. And so I have learned to just ask at the beginning, like, what are you looking for? What would make this work for you? What are your goals? Okay. And then being transparent. Here are my goals. I believe in that cause, but I also have these academic obligations. And so, I will need to be able to publish these findings, but I am committed to providing them to you in language that, the community can understand, and we can do, we can apply for a grant for the graphic design or whatever, this and that, to bring it in these different formats. And so, I'll talk a little bit about that with this new community partnership that I'm developing now, but these are just some examples of some of the things that we've done with this longitudinal cohort. We have a pretty good knowledge translation infrastructure at the Center for Gender and Sexual Health Equity, where I was working in Canada for many years. I don't have that anymore at my current institution. And so I don't know what this is going to look like. It'll probably be more students and us just figuring stuff out on our own, but it's been a great learning experience to see what's possible, that we can do infographics, that we can develop social media campaigns, that we can, bring posters to the community, all different kinds of things, that there's collective skills within the team. And usually students and trainees and community partners are often really creative, and for, a really reasonable fee would be very excited to produce these products. And I think they're important for the psychosocial well-being as well of the people who work on these projects. I think we see a lot of burnout with staff when research feels extractive. It's extremely demoralizing. So for people to know, I just met with a student who's done these very difficult interviews. Okay. This one last, but just to say, this is a current study that I'm working on right now. And so for this project, which has been at the Mexico-US border, we've been working with asylum seeking women, doing really difficult interviews about maternal and infant health inequities that women have experienced during the pandemic. This was a project that started at the invitation of a community partner, which is the first time that's happened to me, where I was really asked to come into the space, and I was not the one that approached them first, that they were seeing these egregious issues occurring during the pandemic and want it documented. I think we're too slow for them. We're doing our best. We did get a publication out within the first year of the study that's hopefully going to be accepted any day. And so I have an amazing postdoc who wrote this paper in like a month, having only joined the lab a few months earlier. But we've struggled to get them things, I think, as fast as what they wanted. But what I was going to say is that a master's student who works with me and has good relations with this community partner did most of these interviews, and they were extremely traumatic interviews. And so, I met with her recently, and we're like, okay, what are we going to do to bring this back? And so just the idea of talking about a workshop we could do, she's documented a lot of obstetric violence, and that's going to be the sort of theme of her master's thesis that she'll defend in the fall. So we talked about doing a workshop with women, defining what is obstetric violence, what are your rights when you go anywhere to deliver a baby, but especially to the local public hospitals in Tijuana. What can you expect? What do you say when things don't go this or that way? How can we advocate for your rights, as women in this space, and to co-create recommendations that the student can build into her thesis and take forward, in her future career, and for the community partner as well. And so we already did a webinar together with the community partner on this recently that was geared towards their fundraisers, right? So they wanted this research data presented to help with their fundraising, because they say people don't believe us when we tell them what is happening, right? That the US, government consistently sort of underplays the harmful effects of immigration policy, and what this looks like on the southern side of the border is absolutely atrocious. And so they really want this information. And so, I think it's really important to just be able to sort of complete that cycle of how we bring the findings back. And the long-term collaboration, of course, here is to advocate for policy change, but this idea about also doing the community workshops. We developed an interim report. Several folks started asking for the findings after this webinar that we did, when I said everything is preliminary. We don't have anything published yet, but there were people asking. And so we, threw together an interim report in a week. And so, there are these things that we have to do, I think, to have these reciprocal relationships be meaningful. And they do involve sometimes late nights and weekends. And that's hard, for those of us who are already working so much. But then if we have flexibility in our jobs where we can take the time off later, I think that those contributions are really important in terms of our investment, whether it's peeling potatoes or pulling an all-nighter to get the community the data when they need it. Those are the things that'll make, I think, the long-term relationships either sink or fly. So there was one more project I was going to talk about, but because of the time, how are we on time?
We're good.
We're good? Okay, then I'll talk about this one really briefly, the IRIS project. So this is another project that I started when I was based in Canada. It is moving into its final year as well. And I'm going to share a little bit about this study because I think it's a good example of how we can build in some of this reflexivity and community engagement practices more into like big data science as well, and that it doesn't need to be just on the front lines when we're collecting qualitative or quantitative data from communities. And so this study is really focused on understanding and generating recommendations for policies and programs to improve health, well-being, and access to health services for migrants and refugees in BC. It started out as a study focused on sexual and reproductive health inequities, much like the one I just showed you. But during the COVID pandemic, we received funding to use that same infrastructure of data collection, analysis, and community engagement to understand inequities in COVID, which have been really stark. And we've actually gotten that data much sooner than the sexual and reproductive health data because it was perceived, it is a public health emergency. And so it's expanded more to this broader now that includes both goals. And so just in terms of some of the community engagement work we've done here, we've had a number of partners, you can see their logos at the bottom, who have really sort of challenged us and brought us really, really excellent suggestions about what community engagement should look like in this study. So I will say, I hope one takeaway you take from this presentation is that not one size fits all. The first study I showed you is like a well-oiled machine. It's this longitudinal cohort. It has a well-functioning CAB. We've known the partners for like more than a decade. They have certain expectations. We have certain expectations. We're always trying to improve what we do, but we have a good sense of the lay of the land. With this study, the community partners, it wasn't really developed as a CVPR study. It was a lot of this, you'll see it's mostly secondary data analysis. We're doing a little bit of qualitative work, but it's a lot of secondary data analysis. And we didn't really think of that at the time. And then when we started with that work, the community and our research assistants had incredible suggestions for how community input needed to inform how we were using this big data. And so that's what I'll present a little bit here. So that's what this backbone is. So we developed, with the collaboration and feedback of our community partners, this backbone for what community engagement looks like across the 2 phases of the study. And we are writing this up now. It's under review with BMG Open as like a commentary. So hopefully for next year's institute, that'll be published and that'll be a resource for folks that describes what this process looks like for this study. So for the administrative data analysis, so we are linking for the first time in British Columbia information using people's unique public health identifiers, you know, because it's a purportedly universal healthcare system, you get one sort of medical ID number for your life. And that is used to document your interactions over any systems of healthcare. And so we're using that information like in terms of health services utilization. And for the first time, we're linking it to people's immigration information based on federal refugee and immigration Canada data. It all happens on the back end through a confidential service known as Population Data BC, which is a really excellent platform for health services research. So there weren't any specific like confidentiality concerns regarding those data linkages or people's individual safety, but there were concerns and questions about community safety of what it means to bring these things together, what the messages that might come out of this work could mean, how we group people in ways that are anti-oppressive and support justice rather than, you know, additional persecution or stigma. And so that was why we developed a LES process. And then there's like what is morally and ethically right, that people wanted to be engaged, that they wanted their voices to be heard. So this project, it's in one of the like recommended readings for today. There's a methodology section that describes how everybody on the team are either community-based researchers, so anybody that was like doing interviews, that kind of thing, because there was a qualitative arm as well. So we have community engagement in the developing of the qualitative research questions and how they, in the end, we haven't done so much mixed methods right now. This is sort of aspirational, but right now we still have like qual stuff happening, quant stuff happening. They are in conversation with one another, but we haven't published a paper yet that draws on both simultaneously. We have one in the works, but for now, this has been more qualitative here so that there's been input on developing the questions, data analysis and interpretation and dissemination. But one of the interesting things that sort of has unfolded during the study was that what community engagement looked like is so different and so far beyond just what the CAB. And so first of all, we have now, I think 4 community advisory groups in 4 different languages, because this is a very multicultural, multilingual study. We have CABs in Spanish, Tigrinya, and in English, and they're working with different communities. And then we have had these umbrella CABs now where we've had several that have brought together those sort of subgroups to talk about like the wider impact of the study. But because there are different like cultural considerations, sessions needed to be held in different languages to make them accessible. Certain community members had sort of reservations about like how different priorities could be like mixed or whatever. At the beginning, it was felt that these groups needed to happen separately. So it's been really interesting, but it's just been a huge amount of work. But in addition to that, our sort of staff and trainees really like challenged us in terms of like, what is the siloing of community versus academics? Like we are a community, we have lived experience. Almost all of the trainees on the study have been people with lived experience of immigration who identify with these communities, who identify with these issues, whether it's because of having a student visa and having a gap in their health insurance or whatever. Like they didn't really appreciate this siloing. And so this study has really challenged me to think about like, what does this mean? And what does the positionality mean in terms of having these dual roles, sort of acknowledging where there's still privilege of like being affiliated with an academic institution or getting a certain kind of degree versus, you know, coming more from a grassroots perspective of working in a community-based organization solely. So it's just been really interesting. So that's why I titled this Cabs and Beyond, because there's this whole process as well that has happened where we have been asking for input from our community research assistants, some of whom don't have any formal training in public health, about data analysis. And so the co-PI, that's our like health services expert, Dr. Ruth Laverne, has done an amazing job with breaking down really complex data analyses with hundreds of thousands of people and bringing them to our staff and cabs with lived experience to say, are we grouping people the right way? Does it make sense to think about immigration using these timeframes or these places of origin? Or what is the respectful way to talk about a person's language ability? It might not be the word proficiency, it might be ability or preference or like all these things that to us might seem a little bit pedantic, but they're actually really, really, really important to community. So I have learned a lot through the process of working on this study. And I started this project as the like main PI, but then after the second year transitioned into a role here in the US. And so now I consider myself much more a learner, like in a co-PI role, but my colleagues are more calling the shots. So this has been great in terms of just learning and seeing the momentum of this team, both like while I was in a leadership role and now just joining meetings and being totally blown away by what they've been able to do and all of the ideas that folks have brought forward. So these are just some examples of some of the knowledge translation we've been doing in this study as well. So one of the ideas that our community researchers and trainees had on the project as well was to do like sort of Instagram style carousels for research participants and community members. So because they were really feeling like morally distressed trying to do this engagement work during COVID, and that we had all this in-person engagement planned and it couldn't happen, and what should we be doing in the meantime? And like gathering more data and doing more remote interviews did not seem to be the highest like principle of this research at the time, where people were really just like wanting to know what the results were. And so we worked with our knowledge translation team at the Center for Gender and Sexual Health Equity to we produced like a video of preliminary findings, which is kind of similar to this. We had like PowerPoint slides that would show kind of like a carousel, and we had our research coordinator speaking in Spanish, talking about the sort of 7 main preliminary themes we had identified in the qualitative interviews that we did at the beginning of the pandemic. And then we were like, okay, producing these videos is not sustainable for us. This project took us like 6 months and people want to know like what's happening now. We had to script it and then we had to do it in 3 other languages with other researchers, and it was too much to make it accessible. So we're like, okay, we're not video production people. Cool. I think with remote research as well, that like Instagram style, so we communicate a lot with the participants on WhatsApp, and so being able to just like send them
Interesting.
where
Oh,
they
wow.
could flip through
Yeah.
and see like 7 little screenshots of like, these are some of the main
Right.
findings, and then like, what do you think? You can call us, text us, we can set up an appointment to get your feedback. So those are some of the things we did.